How are we doing back there, Mary? Isn't that nice? Double trouble. I'll feel your fingers. Come over here. And right on where my tips are there on your side. Yeah, I go really close to that bump, to the vertebra there. And is that the very center of it, Mary, or are we too high? Should we go any lower? We're right on it. It's accurate. Great. And this is one of the areas that I try and spend a lot of time on, so I'll do a bit at the beginning, then I'll put the heat pack on, do her legs, then come back and do the neck again. Going at the same time. And you can work right up. So I've got one hand on the other side, one hand on this side. So Mary has a nodding effect to the movement of her head, especially that bump. That, yeah, that's an eye-opener. It's the C7, T1 area, so where the thoracic vertebra come up and meet the cervical vertebra. They change shape, and there's a bump there. And on Mary, it's very pronounced because the muscles have wasted on either side, and the bony prominences are really easy to spot. And you massage all around that, really easing up the attachments. And this is also where her spine is very stiff, and Mary doesn't have a prone or a supine position that's horizontal. She's in an upright position, slightly reclining for the best breathing, and the way her spine is curving in a flexion, we want to keep it well supported so that she's not uncomfortable. So easing this up, it just helps slow down that, what's called ankylosing of the spine, the fixing of the curve, so it doesn't calcify so quickly. And for anybody, this is a favorite. Right, Mary? And massaging Mary's face from this aspect is an option, and especially to help clear her sinuses. Because all of the face is what's called upper respiratory. And there's all sorts of ways to improve Mary's breathing by just working out from the nose itself, right under the eyes. Just gonna take your glasses off for a minute, Mary. Is that okay? Just put them up here. And the lower orbit of the eye has sinus drainage points in it, called the infraorbital foramen right here. And then all along the ridge of the eyebrow, there's another notch up there called the supraorbital foramen right up here. So the more we're able to massage along there, it really accentuates the drainage of the sinuses in the face, right up and around to the lower lobe of the ear. And that upward movement is the direction of pressure that you want with the lower half of the face. And then with the upper forehead area, it's the same idea, starting from the midpoint and coming out to the temples with your thumb kneading strong stretching strokes. And then I work all around the ears themselves. So I sandwich the ear between my two fingers like this, and I mobilize the ear, and that really helps the sinuses drain. And pinch all the way around. And then the very favorite is this fingertip kneading, a game where you can't see it. We can turn Mary's head and work around here. Because remember, Mary's head is her communication indicator, and she can move facial muscles, and she can nod. She can also turn her head in the direction of an answer, where she will look at what she needs. So being able to keep all of this loose and the sternocleidomastoid muscle loose is really, really important. And then I can put two hands underneath like this, and I'm pulling up this hand, the other hand. So it's kind of like a fingertip traction all along the base of her skull. It's called the occipital ridge. And that's where the large muscle group of the trapezius attaches up here. And also the long spinal muscles called the erector spinae come up and they attach right in there. So I'm going like this, one side, the other side, one side, the other side. And I work from the center out to the edge.
Okay, so Mary, I'm going to take your glasses now. There we go. There. Okay, here comes my hands. Is that pressure okay, Mary?
And then you can work your way up, each stroke a little higher on the face.
Above the lips?
Yeah.
Yeah.
There. And it's really nice to have the coconut oil on
Yeah.
Mary's face because it doesn't get dry and nice. And then we'll come off the bridge of the nose. Oh, outer flare of the nostril.
Yeah.
Very nice.
Yeah.
Yeah, and just you can rest.
Okay.
You know, once you get used to the
yeah,
strokes, you can rest.
Sure.
And then at the outer flare of the nostril, that's it. Just go down to that outer flare and still use your fingertips. It's always a tendency to want to use your thumbs because it's easier. And go down a little bit more where the outer flare is of the nostril. That's it. You got it right there. That's a point that opens up the breathing. So it's really important. And don't make it little. It's always a long stroke. Make it continuous. Yeah. Way up. So you're cutting off a little too short. Yep. All the way up to the temple. Perfect.
And then
Yeah.
back down.
Yeah. And then come off the bridge of the nose each time. Moving up to the lower eye. That's it. The long stroke. Perfect.
Can I stay in that and redo that for a bit?
Yeah, I usually do 3 times along each.
Okay.
And then I'll come off the nose as I'm working up. That's it, exactly. And just tracing the lower border of the eye with enough pressure to make a difference to the sinuses. It really helps clear the sinuses and also lubricate them because she gets quite dry. And right out to the ear again. And then start on the forehead again. So coming up the nose with the thumbs, and you can just let your hands rest. Yeah, and just come right up, and then out the eyebrows themselves. Yeah, and you can trace the eyebrow first. You're a little wild.
I'm wild.
Let me show
I
you.
forgot where your face went. Yeah.
Okay, there.
Sorry.
And then a little higher, and much slower than
Much
this,
slower.
and a little higher.
Yeah.
There you go. Coming up the nose. Yeah, you can just put one thumb up, and then the other thumb. And yeah, and then the other one follows right behind it. Yeah, so they both meet in the middle and then come out the eyebrows together. There you go. And stick right on the eyebrows because it's the upper
Okay.
foramen that you'll get. There's another notch underneath those eyebrows there for drainage. That's it.
Yeah.
Yes, and right out to there. Very good. Yeah. And then a little higher each time.
Okay.
Keep coming up. Yep. Don't be afraid to press. Yep. And then out again towards the temples. Nice working lane. And be slow and firm. How's the pressure, Mary? It's good. Nice eyebrow raise for that. And how's your confidence with that stroke, Michelle?
Very good. I feel better because I can see coming up on this elevation until I get to maybe know Mary's face better. Yeah, this one feels good.
My favorite part to massage of Mary's body would be feet and hands, and then working up the leg to the knee, and then working to about the elbow. I'm most comfortable with those particular areas. I think because it's less intimate and it's less, I feel more confident just because I just new at this and haven't had a lot of experience. So I prefer doing the face and the scalp and the upper leg and respiratory when somebody else is here doing the same thing, just so that I don't make any mistakes.
Hey Mary, we just love massaging you. Hey Mary,
this has got us blue. You've lived your whole life giving
us love.
us love.
Now it's our
turn to see you through.
We love
Love massaging you. Oh, yes, we do. Hey, Mary, you have given us a gift.
in
Your teachings,
Our
spirits you did lift. We'll keep you with us the whole way through. I think you skipped a verse. That's okay. I was like, where are we?
So this is where you get to go wild. So you can make a big claw-like form to your hand, and you can really move the scalp muscles.
Okay.
And this is really great for Mary at any time, because when you're not able to move, you just don't get your circulation going, and you don't get the
Giving
fresh
you a
air.
really nice hairstyle now.
And instead of being so gentle,
Yeah.
let me show you. Hook onto the scalp
Okay.
and move it. So you're not gliding back
Oh,
and
okay,
forth,
okay.
but don't be afraid to hook on it. The difference would be like this as opposed to this.
Oh, okay.
So you really
okay,
want to
okay.
hook on. Hook on, and then you can go to a new spot. Yeah, big generous stroke. Yeah. And they can oppose each other. Instead of moving your whole head around, go like this. So lift up that way. Yeah. And then move to a new spot and hook on. Yeah. And a new spot, like around the back and low. Yeah. And that, oh, doesn't that feel good, Mary? And I'd say that's the favorite, is all around
All
here.
around, yeah.
So you can take your fingertips, Elaine, and again, work all underneath
And then
here.
lower down.
Isn't
yeah.
that nice? Yeah. And then all at the top of the neck there. There you go. Nice. And you go right around to the very center. There. Right there, Mary. Yeah. Nice. Lovely. You're so good. Yay. Do you have any questions I haven't asked you? And keep going.
Keep going. No, it's been great. It's yeah.
And you can maneuver through all of those different massage areas in an hour.
Yeah.
And sometimes, you know, you can ask Mary where to start. You could always start here.
Mm-hmm.
I always like that as a nice finale. But sometimes I'll start right on Mary's lower back, especially if you're on a night massage.
Yeah.
Then she's been in this chair during the day, and you can get right in underneath and work all the lower back. And that's
That feels
relieving
good then.
right away. Right,
Yeah.
Mary? Sometimes you start there. Great. And then what I do is I put the hot packs on to
Mhm.
finish.
Okay.
And, yeah, don't worry, we'll get, see? She's telling you something. What would she be telling you, Elaine?
She wants something underneath her feet. No?
It's close.
You want your socks on? Yes.